let me start by talking about the topic. It's a vast topic, and I struggled for a little bit with what the title should be. And I feel the goal of the talk is really an opportunity for self-reflection. I hope through this talk, the audience participants are able to conduct a sort of self-assessment and self-reflection and find something, an inspiration to introduce a change in their lives, a change for the better. I'm sure we've all read books and read things on the internet that tell us about stress management and mental health and wellness and mental awareness. But it is really the implementation of all this knowledge that is key to making a change. So let's begin by talking a little bit about that. What is psychiatry? Psychiatry was coined, the phrase was coined a long time ago, and psych meaning soul, iatry meaning medical treatment. So really medical treatment of the soul. It's the branch of medicine focused on the diagnosis, treatment, and prevention of mental, emotional, and behavioral disorders. And when we talk of the soul, we're really talking about the essence of human life. So it really sort of, to me, it's, that is what attracted me to psychiatry, the fact that it really caters to the individual's very being. I see myself as a wellness and integrative psychiatrist. What does that mean? It really is the approach to the practice of psychiatry, taking into account the whole person, including everything about them and their lifestyle. And at the core of this treatment is really a therapeutic relationship between doctor and patient in a safe space, which makes use of all appropriate therapies that are scientifically validated to create a foundation for overall health and target prevention of issues before they arise. And I think here, prevention is a key word, because without prevention, I think we'll be floundering in the sea of illness for a long time. Writing a prescription, which many might think is a big part of what a psychiatrist does, is only one element of this care. It is one aspect, and there's so much more to what goes in treating an individual as a whole. Now, some of the common presentations that I see in my office, some of the common complaints or issues that people present with really are, in a nutshell, some of these are the common ones, there are more, but mood happens to be a big one, whether it's depression or bipolar disorder. There are emotional adjustment issues. Anxiety is another big one, including panic and phobias. Attentional issues are big. People come in complaining of, I cannot focus. Now that lack of focus could be due to many, many things, including mood, anxiety, attention deficit, dementia, grief. So really getting to the bottom of what creates attentional deficit. There is insomnia, which is another big complaint, which is inability to fall asleep or stay asleep. Dementia, which as the population ages, as we go through life, memory impairment and executive dysfunction is what dementia is, and it creates behavior changes that can be addressed therapeutically. For women's health, pregnancy-related issues tend to be a big one, whether they're pre-pregnancy, during, or after pregnancy. In a woman's life, many hormonal changes happen, and these hormonal changes go a long way to affect overall emotional health. So kind of getting to the bottom of that. Psychosomatic illnesses, many times, which really kind of refers to patients presenting with sort of headaches and gastrointestinal complaints, whether that be diarrhea or constipation, and just a general bowel dysfunction, and headaches, chronic pain, which all have psychological underpinnings. The other issue could be aging, which I think we, as we go through life, could be navigated successfully or not, unfortunately. And with aging comes loss of a lot of things, and grief. And so that is all addressed in the therapeutic process. Loneliness, coping skill development, I think, is a big one, because the essence of life is really being able to go through it successfully. So development of coping skills is a big one. There are, we all live in a social environment, family conflict, life transitions such as career changes and divorce, parenting, becoming a new parent, or just navigating parenthood. There are self-esteem issues. Substance abuse is a big one, whether it be alcohol. That's really regional and cultural. In the United States, we see a lot of prescription drug use, alcoholism, and marijuana dependence, which is cannabinoids, cannabis. There is trauma that people face as children, and that they bring with them into adulthood. So that's a big aspect of the treatment. There are weight issues, weight gain and obesity also has psychological underpinnings, and how do we avoid that? As I said before, women's health is a big one, and that is a particular topic which is near and dear to my heart. So in my patient population, I see both genders, but women tend to be especially vulnerable to some of these shifts in social and hormonal ways. And the last is sort of work-life harmony, how to achieve that in your life, how to be able to successfully combine all roles in order to have a full and rich life. Now, the therapeutic process, let's take a little time to think and talk about that. As you see on the screen, this was actually, in fact, shared with me by a patient a couple of days ago via text. And this was somebody who was struggling with her in her marriage, and really at a point where it was hard for her to find a way to really keep moving on. And so the therapy provides a safe space for people to be able to talk freely without any judgment, in the company of a trained provider, a trained clinician, a trained mental health professional, and talk about things that are on their mind. And the process itself lends to the things that are said, the things that are discussed, it lends itself to developing self-awareness. And how do we see ourselves, and how do we see ourselves becoming better, I think is really key to this. Now, let's start by talking about health. What is health? Forget about mental health. Let's just focus on the basic concept of health. There are three definitions that we could give to health. Number one is the absence of any disease or impairment. I think we will all agree. Second is health is a state that allows the individual to adequately cope with all demands of daily life. And the third is health is a state of balance that an individual has established within himself and between himself and his environment. So if you would like to think about that for a second here, that is what health is defined as to us. Now, a bigger concept than health is wellness. What is wellness? Wellness is more than being healthy. You cannot be well without being healthy. But healthy is not enough. We have to aspire to wellness, which really is a way of life. It's how we live our lives. It's a lifestyle. It's something we do every day. It's not merely about going to the doctor, getting a prescription, and saying, oh, okay, I'm healthy. That is not what wellness is. It's really the way you live. It's a personalized approach. It's unique to you, to living life in a way that allows us to become the best kind of person we can be, with our potential, with our circumstance, and with our fate. Now, wellness has domains. There are 8 sort of domains of wellness, and that really kind of incorporate a person, a human being. A physical domain, which really is about caring for the body, which we know, exercise, taking the right kind of diet and nutrition, making sure your food is nutritious, and taking care of your body. Emotional dimension is about, catering to your emotions and feelings, yours and of those around you, in a way that it's harmonious. Intellectual dimension is being able to engage in learning, in knowledge, in developing knowledge and skills that make us go through life engaged in a very skillful way and being able to share our gifts with others. There is a domain to wellness, which is spiritual, which basically means finding in our life a purpose, a value, and meaning through combination of all of these. Social wellness is our relationships, our friendships, our community, and how we engage with all of that that's around us. Environmental is the same, where we're interfacing with what nature has given us. How are we treating nature that's around us? Are we, our duty, our civic duty toward the place we live in, whether that's our city or our state or our country. Occupational, which is finding a vocation, a profession that gives you opportunity to really align all your domains nicely. And of course, financial, which by no means is the only dimension of wellness. Wealth does not automatically create health and wellness. It is a crucial component of our wellness, but there is definitely limits to what kind of happiness and wellness it will bring you. Now, when you integrate all these domains, it energizes you in a way that really fuels the body, engages the mind, and nurtures the spirit. That is wellness. When your spirit, your body, and your mind are in sync and functioning to the maximum capacity. I want to transition to talking about the human brain, because the human brain is really the most fascinating organ of the human body. And as early as 500 BC, Hippocrates, the father of medicine, stated these wise words. This was evident to him so far ago, and it is still very relevant now. And I think that kind of wisdom will take us a long way if we keep that in mind. Men ought to know that from the brain, and from the brain alone, arise our pleasures, joys, laughter, and jests, as well as our sorrows, pains, griefs, and tears. Through it, in particular, we think, see, hear, and distinguish the ugly from the beautiful, the bad from the good, the pleasant from the unpleasant. I hold that the brain is the most powerful organ of the human body. Wherefore, I assert that the brain is the interpreter of consciousness. It is mind-boggling what the human brain can do. And it is such an important issue that we talk about the human brain when we talk about life, about health, about wellness, about illness, because it all starts with the human brain. It is the most complex organ. There are 86 billion cells called neurons that are in the human brain. And physiologically, which basically means from a functional aspect, the brain exerts centralized control over all organs, your kidneys, your heart, your lungs, everything. And although we understand the individual functioning of the brain cell with quite a bit of detail, we still are figuring out how these cells create pathways and how those pathways kind of interact with each other in the form of circuits, and how they create our reality. And it's not think of it as a biological computer. I think that's a good analogy. Computers come from the human brain. We've created computers They kind of work on the same model. They've, of course, our brain is very different in how it works from an electronic computer, but similar in the sense that it acquires information from the surrounding world, it stores it, and then it processes it in a variety of ways and gives meaning and reality to our lives. Now, what is a computer? So when I talk of a computer, think of the human brain, because just as a computer has circuits and engages in processing, so does the brain. And to the right of the screen, you see the cognitive triangle, which is a very good, simple circuit to keep in mind. And Dr. Aaron Beck, who devised the cognitive behavioral therapy, really used this as a basis for his therapeutic approach. And cognitive behavioral therapy is one of the therapies that is used in psychiatry and psychology to modify behavior. And the essence of it is that our brain circuit translates, or brain circuits actually, it's plural, translates the thought to action. So a thought arises in my brain, I should run. And behaviorally, from an action perspective, I run. Another example, a thought arises in my brain, nobody likes me. My friend's life on Facebook is so much better than mine. And then it creates a feeling or an emotion of sadness. How could it not? When I feel worthless, when I feel I am not liked, I have no option but to feel sad. And the behavior that comes along with that thought and that emotion is avoidance, staying in bed, feeling unmotivated, and generally not participating in life with the concept of wellness we just talked about. So that thought that creates the feeling / emotion that leads to behavior is a very important equation that we need to remember. It's all in our thoughts. Thoughts create our reality. Negative thought. What is negative thought? You know, we'd all talk about how easy it is to sort of, be in a negative frame of mind. I think it's almost like it's the brain's default mechanism of thought. And if you think about it from an evolutionary perspective, I think it makes a lot of sense, because back in the day when humankind, lived in nature with the rest of the animals of the animal kingdom, lived in caves and went out and hunted and gathered its food, the human brain was programmed from an evolutionary perspective to see danger. For survival. It was crucial for survival. It was our survival instinct. So if we were out and about in those days and a tiger came in our path, we ran. Our brain shut down to all possibilities and we ran. The thought did not pop up, oh, I should sit down and eat something. Oh, I should sit down and relax. No, there was only one thought, and one thought, run. And we ran. And what this did is this sort of narrowing down of possibilities in that moment of fear and anxiety, where all you can think of is one option, is sort of what we see now. Now, the problem is our brain is still programmed from an evolutionary perspective to respond to these dangers in our environment and our negative thoughts that go with it in the same way, by shutting off the outside world and limiting the options we see around us. And that, I think, creates a problem, because nowhere in today's world are we facing a tiger or a lion. Our survival, for the most part, is not threatened. Now, this coronavirus situation is unique because our brain sees it as a threat. And when we see something as a threat, we run or we crumple down in a heap of anxiety, and we find ourselves paralyzed almost with fear. And in stark contrast, when we are experiencing positive thoughts, which brings about positive feelings like joy, contentment, and love, our brain and our mind expands to other possibilities. We become more creative. We see other possibilities. We see other options. And this has been validated by research and studies that show that the human brain, when you look at it with MRI, with magnetic resonance imaging, both structural and functional, you see actually how the brain works when given negative feedback or negative stimulus, or versus positive stimulus in terms of positive thought. Positive thought opens up options for us. So how we know positive thought is good for us, positive thinking is good for us. How do we override this evolutionary negative thought brain circuit? Is I think the big question. How do we do that? And the process is simple, but it takes time and practice. You are, after all, creating a new habit. For instance, a negative thought, I'm not smart enough for school. Positive spin, a positive thought would be, I deserve to be here. I have succeeded in the past and I know I can do it again. Another example, no one likes me, no one wants to hang out with me. And how with the positive thought in the same situation would be, I am a good and interesting person and I'm liked by the people I meet. So how do we change our thoughts? Because the health benefits of positive thinking are tremendous. We know that. I think we've all heard and read so much about it. It results in lower levels of distress, lower rates of depression. I can promise you that in my career, in seeing all of this through my career, I have seen the tremendous impact of positive thought in keeping depression away. Greater resistance to the common cold and other infections, better heart health, and reduced risk of death from heart disease. How can stress and negative thought not affect your heart and every other aspect of your being? It leads to better psychological and physical wellness and well-being. And you learn to cope better because you're now seeing options and possibilities and not merely running to survive. And you therefore increase your lifespan. So those are some of the health benefits of positive thought. Now, again, going back to the topic of converting our negative thoughts into positive, let's talk about habits. What is a habit? Habit is essentially a behavior. So when you think about that thought, emotion, action, or behavior triangle or equation, habits are behaviors. And this is a routine of behavior that is repeated regularly and tends to occur subconsciously. I think that's the key word here, subconscious, meaning outside of our conscious awareness. It is maintained by repetition. We do them over and over and over again to the point where as a circuit in the brain, it's encoded. It becomes powerful. It takes hold. That circuit, you're feeding it every day with your habit, and it runs in that same groove over and over and over again without you even realizing, because it's happening subconsciously. Because habits are subconscious, they require very little energy. So in a way, they can be seen as self-regulating. They regulate us in our own way. Maybe it's dysfunctional, maybe it's functional, but they serve that purpose of regulating, and they require very little energy. In fact, and this is mind-boggling, that up to 40% of our behavior is repeated in the form of our habits. So 40% of what we do is outside of our conscious awareness. And so going back to sort of, again, the habit formation, there are components to habit formation. Number one, you have to have a trigger, which is essentially a cue. And then you have your routine, and then you have your reward. So typically it takes 2 months to form a habit. And now with this COVID pandemic, we've had 2 months to sort of train our brain in a certain way. Some of us have been able to do it to our benefit. And unfortunately, some of us were not able to do that to our benefit. And we're seeing the results of that change, because in 2 months approximately, we can change a habit. What we were doing before, we can change it. And after repetition, a new circuit can be created. Going back to this sort of equation, a cue could be feeling stress. That's a trigger. I'm feeling stressed. I go to a routine perhaps of drinking alcohol or smoking a cigarette because I'm feeling stressed. And the reward to my mind is relaxation. It relaxes me, so I do it. And when you do this over and over again, it becomes encoded in the brain. How do we change that? We realize what the trigger is, we realize what the routine is, we realize what the reward is, and we introduce changes. Much has been said about changing habits and how it changes your life. Books upon books have been written. I think if you Googled it, perhaps 500 books and titles would show up with the same message: change your habits, change your life. But it is a very, very wise and very practical and applicable way to look at this. It is really the key to health, wellness, and quality of life. What is my quality of life? How I live my life? That has tremendous impact from changing our habits. Now, again, very difficult, easier said than done, very difficult to change, since it involves rewiring your brain. You are creating a new routine, a new loop, a new circuit in your brain, and you're discarding what has been encoded. Does it require willpower? Yes. Does it require self-control? Yes. Does it require strategies? Yes. And I think those are the three tools one will need to sort of change a habit. You have to have a will, a thought, a desire. This cannot go on, I must change, and exercise some self-control. And I think self-control makes us better people. If we act impulsively, where is the wisdom in that? So self-control development, when not on our way to developing and changing our habits, we exercise self-control, and that is good for the brain. Strategy, for example, not buying a cigarette pack, not having access to cigarettes is a good thing. In terms of a strategy, when you don't have it, you won't need it. But again, like I said, willpower and self-control. For example, if you decide to implement a routine of exercise, you go to bed at night and you keep your exercise clothes by the bed, all of it, including sneakers and anything else you require for your run or your walk, right next to your bed. So the first thing that you see when you wake up are those tools to change your habit. And you start running or walking, and you will see within a few weeks, you will not be able to go without it. So old patterns tend to repeat unless we build new circuits. Now, one of the interesting aspects of behavior is understanding the why, because when we can answer the why, we can understand why we act in certain ways, why we respond in certain ways. And that is the key to understanding human behavior, human nature, and creating change. Why do I do what I do? Why? How can I change it? So the first question is why, and then the how follows from there. So in answering this question of why and how, we go to the concept of neuroplasticity. Again, it is a concept of not so recent origin, and it has to do with the brain. Neuro, the brain; plastic, meaning it's malleable. You can change it. There is the age-old belief that the brain is fixed and it cannot change, it cannot learn, and it cannot grow past a certain age. And nothing could be further from the truth. Now, for example, in a stroke patient, we see somebody who's had a stroke, how gradually they can regain the function of their limbs or of their speech or of their hearing many times. And that speaks to that's a very simple example that speaks to the neuroplasticity of the brain. really the meaning of neuroplasticity is that the human brain can actually change its physical structure and processing, so its function, based upon our own input of thoughts, emotions, and behaviors. So going back to the triangle of thought, emotion, and behavior, you make that triangle good, and you will see your brain change for the better. One of the concepts of that has gained recent traction, has gained traction recently, and is heard all the time, is mindfulness, the concept of mindfulness. These are, again, in sort of switching in these topics, we're talking about healthy things, healthy concepts, wellness concepts that give us the tools to change our lives. And mindfulness is just one of those topics that can be a big tool in creating a well life, a life full of wellness. What is mindfulness? Very simply put, as I heard one of my colleagues at the University of Miami, Dr. Jha, speak about it, it's paying attention to your attention. Is really a simple and profound way to sum up the concept of mindfulness. Paying attention to your attention. Where is my attention? And what does that entail? How can you do that? Number one is consciousness. You have to be consciously aware. And we just spoke about habits that happen outside of our conscious. So this is the opposite of that. Being mindful, being consciously aware in the moment without emotional reactivity. And I think this is a good slide that kind of underscores that concept. You have a father and daughter going for a walk, and the father's brain is full of all these thoughts, whereas the daughter is focused only on seeing the beauty around her. Look at what the difference is. I think it's tremendous. So when you're paying attention to your attention and being consciously aware in the moment without emotional reactivity, you are mindful. It involves practice, like everything else in life. Practice makes perfect. Moving on to the concept of mindful behavior. What does mindfulness do? So being mindful creates a space to pause, to hit the pause button, where we can then have the opportunity to replace our impulsive reactions with thoughtful responses. So you have a behavior, that is on autopilot. Like I said, the habit. You have a stimulus, a trigger, a cue in your environment. Somebody says something which rubs you the wrong way, which doesn't sit right with you, and you react. You react impulsively, angrily, argumentatively, violently. That is being on autopilot, living unmindfully. And in contrast, when we have the mindful way of living, something happens, which is a stimulus in our environment. It's a cue, it's a trigger. And we have cultivated the pause button, the ability to stop for a second and reflect, which allows us the power, which gives us the power to alter our response. How do I react to this in a way that will be good for everyone, including myself? So mindfulness really is about present time awareness. And that in and of itself, it's not just about that, because it leads to more good things. Goodness creates more goodness. Success creates more success. So this awareness of living in the present creates alertness, creates clarity, and creates concentration. So when people say, oh, I cannot focus, I cannot concentrate, I feel so foggy, perhaps introducing all these lives, again starting with routines of exercise and nutrition, and and waking up at a good time, and doing all of this, including cultivating mindfulness, we can fix some of these issues. And also equanimity, which is basically openness, being more open to what's around us, being able to give our brain more options, being more accepting and tolerant of that's around us. If you see somebody that's struggling, you have more empathy. You can look at them and say, oh, what can I do, instead of neglecting that or failing to see that. And it makes you more receptive. You are able to actually hear the other person's point of view. You become more flexible as opposed to being more rigid. So that is the benefit of mindfulness. And in today's world, many corporations, many businesses, many multinationals, they're all engaging their employees in mindfulness training. And what this translates into the workspace is all of these good things. Employees have reduced stress and anxiety. They have improved relationships in the workplace. They are able to focus and pay attention better. They have more clarity. They have more concentration and attention, and they have better conflict resolution skills because now they have the pause button. They are not reacting impulsively to what the boss says or what a coworker says, and they can actually graduate and calibrate their responses. And improved impulse control, of course. That is the basic first step. It improve, everything else flows from that. So a good concept that we can implement everywhere, personal and professional lives. Viktor Frankl, survivor of the Holocaust, said, "Between stimulus and response, there is a space. In that space is a power to choose our response. In our response lies our growth and our freedom." Very wise words, and I think it would serve us all very well to remember them from time to time. Moving on to meditation, which is another tool to implement mindfulness. What is meditation? To me personally, it implies a stillness, quieting your mind, perhaps by focusing on your breath, because stillness has many benefits. It helps in consolidating memory. It promotes empathy, my capacity to relate to fellow human beings in a way where I can offer them support, and enhancing creativity. Now, through all, after talking about all these sort of, in a nutshell, about all these beautiful concepts and healthy concepts of prevention and things to invite into our lives that give meaning to our lives, let's move on to the concept of illness, which unfortunately, much of medicine has become about. It has shifted its focus from wellness to illness. Don't wait to fall ill to go and then start addressing your health, because prevention, and like they say, like Benjamin Franklin once said, an ounce of prevention is worth a pound of cure. Prevention is the key. But let's say that didn't happen. Let's say we're at the illness point. Again, from a psychiatrist, psychiatric, psychologic perspective, let me introduce the concept of sort of a victimhood mentality that I see so often. Many chronic illnesses, whether it's heart disease, diabetes, depression, obesity, they're all completely or partially avoidable. I hear statements like diabetes ho gai, depression ho gaya. It almost implies like I had no control over this. This just happened to find me and affect me. I did nothing to invite it into my life. And that, unfortunately, is not true. We have to assume some sort of accountability and responsibility, our personal responsibility toward our health and wellness to avoid these chronic illnesses. And they're all interrelated. Depression affects diabetes, diabetes affects depression, heart disease affects depression, depression affects heart disease. So they're all interlinked because the mind-body connection is huge. There's nothing bigger. Let's talk a little bit about depression, which is, I think, the commonest mental health disorder we see. Globally, more than 300 million people of all ages suffer from depression, the leading cause of disability worldwide, and is a major contributor to overall global burden of disease. And more women are affected by depression than men. Depression can and does lead to suicide. And the good news is there are effective psychological and pharmacological, which is essentially medicine, medications, treatment for moderate to severe depression. Now, mild depression does not, in the professional view, does not necessitate treatment with medication. I think we can engage in talk therapy in the therapeutic process and find ways to fix that. But moderate to severe depression, which unfortunately can be very, very, very disabling, does require medication. So I left the slide blank because it's something that there are no bullet points to this. This is about the concept of adherence to treatment. What does it mean to adhere to treatment, to be compliant with treatment? And I say to the folks that I see to the patients that I see in my practice, you have taken the time and energy and spent money to engage in this treatment. So please, after making that decision, which is a big one, to get care, after making that first hurdle, you are now here for treatment. And what would really help is if you stuck with it. Nothing is more frustrating to see as a clinician, as a professional, than to come up with a very thoughtful plan, a very thoughtfully prepared treatment plan, and for patients to not adhere to it, to not stick to it, and do their own thing. If your diabetes requires medication, by all means, you should and must take that. If your depression requires medication, you must take that. In my mind, what medication really does is it gives you attention in a crisis moment. I give you medication that really has quick results, you feel better, but then in feeling better, you have to use that opportunity to create these health and wellness motivators in your life. Because when you're down and depressed and you cannot get out of bed, if I ask you to meditate, I don't think you're capable of that in that moment. But when that moment has passed and you're feeling better, you must cultivate these habits. And that's my little talk on adherence to treatment. For instance, if somebody has pneumonia and the doctor prescribes antibiotics, why would you not take them? You have to take them. But once the pneumonia is better and you're feeling better, perhaps you could practice yoga and breathing exercises to create wellness in your life and avoid pneumonia in the future. So this is a little slide that talks about depression, and depression has many manifestations. We talk, okay, depression, what is depression? I think this is a nice little slide that helps us conceptualize the concept of depression, which has three basic categories of symptoms. Number one is emotional, number two is cognitive, and number three is physical. So when somebody is depressed, their emotional symptoms are sadness, anxiety, irritability, hopelessness, helplessness, worthlessness, inappropriate guilt, lack of enjoyment, and perhaps even suicidal ideation. The cognitive symptoms are poor concentration. Like I said, how can I focus my attention if I am depressed cognitively? One of the cognitive symptoms is indecisiveness, which is basically not being able to make decisions, having problems with memory, and not being able to think clearly. Physical symptoms are headaches, stomach problems, feeling restless and agitated, feeling fatigued, meaning tired, reduced libido, feelings of pain, insomnia or hypersomnia, meaning sleeping too little or sleeping too much. And also the same goes for weight, either losing a lot of weight because you're not able to have an appetite, or gaining too much weight because you're stress eating. So those are the basic domains of depressive symptoms. And as a layman, as somebody out in the community who, as a person who doesn't have familiarity with some of these intricacies, I think the thing to keep in mind is that what you might see as a manifestation, as an expression of mood disorder, is irritability. Somebody being irritable, being abusive, physically or verbally, being agitated, being restless, acting impulsively or recklessly. Drugs, using binging on alcohol or cigarettes or drugs, and becoming so lethargic that they can barely get dressed, cannot get out of bed or feed themselves, or even attend to their basic hygiene needs. So those are the ways that you might see somebody manifesting a mood disorder. Now, depression is a complex illness. One question might be, what creates depression? What am I genetically susceptible? Is there something in my genetic makeup that makes me more vulnerable to depression? We don't know if that's entirely true. It may be a contributing factor amongst others that create the perfect storm to create depression. So it's a very complicated illness. Genetics, yes, that plays a part. Some people are born with a certain genetic makeup, but again, these genes can be overridden by creating a better environment for yourself. So you can fight genetics. It doesn't have to spell doom and gloom. Environmental stress, lack of support, loneliness, and isolation are big factors contributing to depression, which we might be seeing in this whole Corona COVID scenario, where feeling lonely, isolated, not being able to get to our usual lives is creating a sense of sadness and depression in many. Now, this third one is especially important: repetitive negative thought, and huge contributor to depression and keeping depression alive. So we must change our negative thought through means we just talked about. Hormones are very important, especially for a female's life cycle. Hormonal times in a female's life can really play a part. And there are some personality features and traits that we have that make us more susceptible. You might have heard the saying, how do you see life? Do you see it half full? Do you see the glass half full or half empty? And I think that's a very good sort of simple example of how we see life and how we react to it that create fertile ground for depression. Substance use, again, alcohol, it might give you some respite, some release in the short term, but overall it creates and promotes depression. Physical illness, including chronic pain. How can you be happy if you have pain throughout? And if you're not happy, you will feel more pain. So again, a bi-directional sort of relationship with the body-mind connection. So these are some of the causes and contributing factors for depression. A little word about neurotransmitters, which again is the brain. These are chemicals that the brain produces that we know of. Again, we don't know everything. We know far from everything. But from our understanding today, we know that there are neurotransmitters, which are basically chemicals in the brain, made by the brain. And some of these names you might hear or see or read about: serotonin, dopamine, noradrenaline, acetylcholine, GABA, glutamate, melatonin, histamine, endorphins, and oxytocin. I mean, these are some of the common ones. And all of them interact in a very complex way to affect our mood, our anxiety, our sleep, appetite, memory, libido, impulsivity, concentration, to name a few things. Again, this list is by no means complete. And for example, when a mother holds her baby, what her brain makes a lot of is oxytocin, which allows her to feel good and be able to bond with the baby. What are endorphins? Those are chemicals secreted by your brain, made by your brain when you run or exercise. So those are basically these, some of these are the body's own feel-good chemicals. Histamine is helpful towards sleep, as is melatonin. Serotonin is, again, very important in mood regulation. Dopamine is the chemical that our brain makes when it experiences novelty, when something new and something that gives us a reward. Who doesn't feel happy when they get a promotion? What does your brain make when you get a promotion? Dopamine. So natural neurotransmitter boost. So these are the chemicals in our brain. How can we keep them in a good balance through our own endeavors? And some of these endeavors are exercise, spending time in nature, which is a big one. We must all get out from the hustle and bustle and be in silence and nature and appreciate, and that will boost the neurotransmitters that your brain makes. Nutrition, eating the right kind of food, no fried, no oils, no, more fresh fruit and vegetables, really. meditation, goal achievement. You have to, success builds success. You set a goal, you achieve it, your brain responds in a healthy manner. Gratitude, the practice of saying thank you to life, to God, and to those around us. Novelty, meaning something new, and that's the importance of sort of escaping from monotony and engaging in new endeavors. Even a job change, something new that propels us, that makes us think in a different way. That is all good food for the brain. Happy memories. When you think of memories, think of the happy ones, because then you're actually helping your brain be healthier. Those bad memories are toxic. You have to discard them like toxic waste. Every time, being conscious, being mindful, a thought pops up, a bad memory, take it and discard it. And of course, therapy, the therapeutic process, which in my mind is big. In this day and age, we're hearing a lot about the concept of a personal trainer. Oh, I have a personal trainer, I go to the gym. How is seeing a therapist any different from that? Why must you not process your thoughts with somebody who can be a guide, a friend, and a non-judgmental, professionally trained individual that can guide you to think differently, to change your perspective, and to make your life better? So therapy is huge. Now, some of us are, unfortunately struggle with depression, or have someone in our family or friend circle that suffered from depression, and you are in the role of being a caregiver for them. How do you navigate that? Number one is, making sure they get professional help, because figuring out that aspect helps them get evaluated and treated in a way that they deserve and need. And in that process, another important aspect is education, where you must educate yourself and the person also, whatever you can do to facilitate that process. So ignorance is not bliss, and education is empowerment. Be empowered to be of help. Consistent support and understanding. When somebody is struggling with depression, they need consistency. They need somebody to be there for them, and on a predictable basis. What hurts more than helps is inconsistent support, and being able to be there for them in an empathic way. And then helping the person with depression to stick to treatment plan, making sure they take their medication, making sure they make their appointments, making sure they're able to be out and about. And recognize that depression is often expressed as hostility, rejection, and irritability. So if you're seeing a person being hostile or rejecting or irritable, that is a sign that, it doesn't mean don't take it personally in that situation, and just do your best to help them. Adopt an interaction style that puts the depressed person in charge. For example, don't make them feel worse about the not doing that's happening in their life. Instead of saying, oh, let's go to the movies tonight, and then you see they're clearly not up for it, it makes them feel even worse. Instead of saying that, a better way to say that would be, I'd like to see a movie tonight. Which one of these do you want to see with me? So that gives them the impression of actually being in charge of making decisions. And I think how we say what we say makes a huge difference. The next point is to encourage the depressed person to seek professional help, and help them as much as you can by making sure they get to their appointments and so forth. And remember that treatment is very effective, and the person who you care for will improve with treatment within a few months. It doesn't take hours or days. It does take time, but patience is a big virtue when we're looking at this treatment process. Same subject. We must support the depressed person in opportunities to be rewarded, such as visiting friends or going out for activities. And don't force these, though, so just have to sort of see what they're up for. And make sure you notice and praise any improvement. They need that. Be genuine, compliment them and encourage them. And of course, leave time for yourself and your own needs. We cannot, none of us can pour from an empty cup. We need to fill ourselves first and then be able to offer ourselves to others. So leave time for yourself and your own needs. It will help both of you. And consider turning to support groups for help. And I think we're kind of nearing the end of it. So a little something about mental health and COVID times. And I think if we really think about it, all of the stuff that I spoke about today, I think is very, very applicable and implementable in these times. And we must realize that people who are quarantined are very likely to develop a wide range of symptoms of psychological stress and disorder, including low mood, insomnia, which is lack of sleep, stress, anxiety, anger, irritability, emotional exhaustion, depression, and even post-traumatic stress symptoms. And like one of my patients said to me, she had attempted suicide in the past, and she said to me that all this social isolation was triggering her to think of the time that she was in a bad place and attempted suicide. So we talked about that, how that can trigger some of these bad memories and how you process them differently. And low mood and irritability specifically stand out as being very common, is what the study found. So these are some of the fallout from COVID that we're seeing from a mental health perspective. So what are some of the things we can do? Stay informed by all means. Knowledge, like I say, is empowerment. Education is empowerment. Stay informed, but limit news intake, and always go to a reliable news source, somebody that you trust, and you take it in limited quantities. And post mindfully. Everybody in this day and age has access to tremendous platform through the use of social media, and we must post mindfully. Don't just on WhatsApp groups, don't go promoting anxiety and panic when you things that we say or put out there cannot be taken back. So please post mindfully. Focus on the things that you can control, like your own personal risk. What can I do to make myself safe and to keep others around me safe? I cannot control where, and how much the extent of the damage is going to be, but I can minimize personal risk and the risk of those around me. And stay connected even when physically isolated. And I think in that sense, the phrase social distancing is really not a good phrase, because it really should be physical distancing. Socially, we should be all close to each other. And not every conversation has to be Corona focused. Talk about healthier things. And remember, Corona is not the only thing that's contagious. So are emotions. So stay away from people that engage in panic mongering or people that are negative and reinforce and ramp up your fears. If you yourself are struggling, try and associate more with people that are more thoughtful, level-headed, and good listeners. And take care of your body, mind, and spirit. Be kind to yourself. Maintain a good routine, regular sleep, meal, work, and take time out for activities you enjoy. And get out in nature. Make a new recipe, a craft, or a piece of art. Exercise, very important. Cannot say enough about that. Do not self-medicate with alcohol or other substances, and take up a relaxation practice. We know we all have the time, and we should use this wisely to our advantage. And help others. It will make you feel better. And thank you again to MediCounsel and the SSS Foundation in making this a platform toward helping. Thank you so much. I hope this was worth your time. And again, thank you for tuning in.